Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your Handihaler inhaler. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. You'll need to have the capsules for your Handihaler ready before use. These capsules can only be used in the Handihaler inhaler. Do not swallow the capsules. You should always sit upright or stand up when using your Handihaler inhaler. Begin by opening the dust cap by pressing the piercing button. Open the mouthpiece by pulling it upwards. You'll see a compartment for a capsule underneath the mouthpiece. Remove a capsule from the blister pack and insert it into the chamber. Close the mouthpiece until you hear it click. Press and release the green button. This will pierce the capsule. You should only do this once. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Now place the mouthpiece into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Take a deep breath in through your mouth so that the capsule vibrates inside the inhaler. Keep breathing in slowly and deeply for as long as you can. Remove the inhaler from your mouth while holding your breath for up to 10 seconds, or for as long as is comfortable. Now breathe out slowly and gently away from the mouthpiece. To make sure that you've inhaled all of the medication from the capsule, you must repeat the process again. Breathe out fully, put the inhaler in your mouth, breathe in slowly and deeply, hold your breath, and then breathe out, just as you did before. Once you've used the inhaler for a second time, open the mouthpiece and remove the used capsule. You can throw this away in your normal waste bin. Close the inhaler once you're finished by clicking the mouthpiece and then the dust cap back into place. If your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. Ask your pharmacist if you're unsure whether your inhaler contains a steroid. We recommend that you clean your Handihaler about once every month. To do this, open the dust cap followed by the mouthpiece. You can also open the base. Run the inhaler under warm water and leave it to dry. You should replace your Handihaler once every year. If you're unsure about how to use your Handihaler inhaler or have any other questions, speak to your GP, practice nurse or pharmacist for assistance.